Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Let's talk about using spot urinary sodium for diuretic response. It can be difficult to find the right dose of diuretic for a patient in active heart failure. There's many different approaches, including the book House of God has their own approach. This is a proposal of using a spot urine sodium. What does that mean? We're just grabbing the sodium level at a point in time. And it's lessly 2 hours after a diuretic, and we're probably talking about IV diuretics. If it's less than 50 to 70 post 2 hours diuretic, consider doubling the dose. Or if urine output is less than 100 to 150 milliliters an hour in the first 6 hours, consider doubling the dose of diuretic. Now, is this perfect? No. No. And do you do this blindly? No. Remember, your patients are an N of 1, and you actually have to examine them, think about it. What does this doesn't take into account for? Well, it doesn't take into account for the severity of distribution of fluid. We have a lot of patients that you're going to have are extravascularly full, but intervascularly depleted. So you kind of have to get those fluids into vascular. Remember, the loops don't work if there's no fluid in the loop of Henle to diurese. So you have to get the fluid to the loop of Henle. It's less useful after 1 day. So the first day, the first 24 hours, you can try this. After high urine output decreases the sodium excretion with rapid decongestion, limited by the kidney function. So in a lot of these studies, the kidney function needs to be normal to make this work. It also doesn't take for the high salt intake. Well, what gives you a high salt intake? Well, bicarb. You give somebody bicarb, one of those 50 amps is going to have 50 milliequivalent amps is going to have about 2 to 3 grams of sodium in it. Also, too, is antibiotics. Antibiotics are a huge source. Piperacillin, Tazobacter. 2 to 3 grams. And you can get in a day even more, depending how you're dosing it. Chronic use of diuretics will also throw this off. Remember, this is less predictive after first 24 hours, but if someone's coming in for chronic diuresis, like they're using chronic diuresis, less likely to be helpful. And this will work for loops, but when we start using newer things like the Vaptams or the SGLT2 inhibitors, and this spot urine sodium may not be as helpful.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.